Everyone, welcome back to the Kind Health Group podcast and YouTube channel. We are back. Hi, Annie.
Morning.
It is Friday, March 27th, and we have a great guest with us today, Dr. Richard Harris from Houston. But before we get to him, a couple updates on the day. First of all, it's Friday. Yay, we made it through another week, which feels like 10 years. Anything new you'd like to share?
Well, no. Today I learned that on the Weather Channel that you can put in your zip code and it will tell you exactly how many cases are in your area, which I guess is kind of helpful.
Okay, that's good. That'll increase everyone's stress level every time they want to just see if they can walk outside. So that'll be helpful. Okay. Not much has changed since yesterday. Stay-at-home precautions still in effect, really, all throughout California and in more states. We have to pay attention to these and really adhere to them in order to get back to our whatever our normal lives are going to look like after this. So I encourage everyone, stay home, wash your hands, the usual. We're going to get to Dr. Harris right now. Hi, Dr. Harris.
Hi. Good morning or afternoon, I guess, for me. Good for y'all.
So I was going to give a quick intro on you. So Dr. Harris is born in Cleveland but raised in Houston. He's a board-certified internal medicine physician and a pharmacist, which is a unique combination. Dr. Harris attended the University of Texas at Austin for pharmacy school and then pursued medical education at the McGovern School of Medicine in Houston. He completed his residency at UTMB in Galveston. And after finishing residency, Dr. Harris worked for a large medical group in Houston, but left that practice to pursue holistic medicine. He now has a client-centric view focused on building relationships and trust through comprehensive lifestyle medicine combined with genetic and micronutrient testing. In his spare time, he's an avid reader, weightlifter, video game enthusiast, and author, and he enjoys sports, traveling, philanthropy, church, and keto donuts, which I want to hear all about. Welcome.
Thanks for having me.
So it sounds like you and I have, apart from, tell me about what, when you were in pharmacy school as a pharmacist, led you to pursue medicine.
Yeah, so it was interesting. When I got into medical school, my mom showed me a picture that I drew when I was 3. And I didn't remember this, but it said, when I grew up, I wanted to be a physician because I wanted to help people. But I kind of got away from that. In high school, I wanted to do biomedical physics, thought I wanted to work on prosthetics and stuff like that. Did physics for a year, hated math, loved physics. Switched into biochemistry. I thought I wanted to do bench research, did bench research for 2 years, didn't like it. So I was about to graduate with a degree in biochemistry, and I didn't know what I wanted to do. So I worked in the dean of pharmacy's lab. He said, come to pharmacy school. I think you'll like it. In the first year of pharmacy school, I really sat down and asked myself tough questions. If I'm 65 looking back at my life, what do I want to say I did? And if I didn't go to medical school, would I be mad at myself? And the answer was yes. But I'd never quit anything in my life. So I finished out pharmacy school, took a year off, and then went to medical school.
Yeah, that's amazing. And I feel like you and I have had sort of similar life trajectories. I went to medical school later in life and, had some early similar experiences. So while you were practicing medicine, it sounded like you also were working for a large group like I was. And then at what point did you decide that you wanted to do something different and practice differently for yourself or for your patients, and what kind of led you there?
Yeah, so it was my own journey, really. My family has a lot of health issues, cancer, Alzheimer's, Parkinson's, high cholesterol, high blood pressure. I mean, you name it, it runs in my family and my parents or grandparents. Autoimmune diseases, everything. And so I started looking at, okay, what can I do to really minimize my own risk? And I knew that lifestyle things weren't taught in medical school. So I said, okay, I'm going to go learn about what are all the things I'm doing on a daily basis that are either helping my health or hurting my health. And so I did just a deep dive onto every single paper I could find for about a year. And then I realized that the conventional system has it all wrong. It's all backwards. We focus on pills instead of lifestyle and behavioral modification. And that's when I realized that if I stayed on the conventional path, all I was going to do was be putting Band-Aids on sick people and not actually helping people, not actually preventing disease. And I wanted to be someone that prevented chronic illness instead of just reactionarily treating it.
Yeah. And so when you left your existing practice, did you start with a new set of patients? Did you take other patients with you from your old practice? And how has it been going?
Yeah, so unfortunately, when I left the other practice, I kind of jumped into too many things at once. And so I'd opened my own clinic. I had started my own business as well. I had a couple other businesses, and I started consulting for companies, and I was getting my MBA. And about 6 months into doing that, I was like, okay,
of course you were, yes.
Yeah. I was like, something's got to go. And so I looked at it, and I decided to shut down my clinic at that time. And then I said, okay, well, how can I still provide the same level of value to people? So I still do like online health consults, but that's when I started my podcast to really help people get behind the lifestyle and behavioral modifications, and just so they could make decisions about their health from a place of power, creating informed health consumers. That's what I've really started to focus my attention on, was getting the message out there about holistic medicine and about that there is a better way to prevent you from being burdened with chronic disease.
Yeah. Annie, you look like you were about to ask something over there.
I was. It's sort of your practices sort of mirror each other's as far as, getting away from the traditional practice. And that's sort of what I do as the health coach. I, work with patients one-on-one. We talk about diet, nutrition, stress. I know stress is a big factor right now. So do you meet with your patients virtually at this point, or have you always met with them virtually?
Initially it was in office, but now I do virtually through DoxyMe, right, which is a HIPAA certified video chatting service. And then sometimes the ones who are still around town, I'll meet up with around town, like we'll go to lunch or have dinner or something like that. To me, my focus on medicine was more, I wanted to get rid of that traditional doctor-patient relationship, right? Where it's, oh, I'm the doctor, I know best, I know everything, do what I say. If you don't do what I say, you're an idiot. And, that whole old paradigm. And so I wanted to adopt more of a client-centric focus, because when someone is your client, you do what's in the client's best interest, right? You form a partnership. You work together to improve what the client wants, or to help the client achieve their goals. And so that's how I started approaching my own practice, was more in that, hey, we're in this together. Let's work together. I have a knowledge base. You have a knowledge base. Let's come together and let's figure out the best way for us to move forward to help you achieve your goals.
That's a very modern model. I like it.
Yeah. It's, again, very similar to what we're doing as well. Everyone's talking about overwhelming the system. Something I talked about the other day, someone asked me, well, who knew healthcare was in such bad shape? And I was saying, well, all of the doctors knew this. And so, how do you think it's going to change? Where do you think it's going to go? And how do you think it's going to change healthcare?
So I'm hoping there's a couple good things that can come out of this, because I always try to focus on the positive. I always try to put my trust in God and lead where he takes me. But instead of focusing on the negative, I look at the positive. Okay, so what's the good that can come out of this? One is I'm hoping that we start putting more emphasis on research in microbiology and virology, right? Because, for most of human history, things like this happen, and this is what killed off most people throughout our history. And we kind of got away from, we got lulled into a false sense of safety in the post-antibiotic era, right? And so we hadn't really been thinking and game planning for this. And then big drug companies are not putting money into research for virology, for microbiology. You know, they're all in autoimmune and cancer. That's where all the money is right now. So I'm hoping that's one thing. An interesting thing that's happened where I am is that our overall utilization at the hospital has gone down dramatically. Now, part of that could be the elective cases were canceled. A part of that, I think, is that people aren't coming to using the ER like a primary care. Like, we all know that that happens. A lot of people come to the ER like a primary care. And so that clogs up resources for people who really need them. So I think you'll see some utilization review happen after all of this, about how are we really effectively using our resources. And the third thing is, what I'm really worried about is if things did get really, really bad in Houston. Luckily, right now, we don't have too many cases because of the chronic disease burden. That's more of what I'm worried about, is that all these people with heart disease and lung disease and cancer and diabetes, we all know they're going to have worse outcomes. And so now all of a sudden you're dealing with COVID and you're dealing with an exacerbation of their heart failure or their kidney failure. And so that's what I think is the most likely cause that could overwhelm the system, is the fact that we in general are a pretty sickly population. And so you add in a pathogen that has the potential to spread very quickly, and that's a recipe for catastrophe.
Yeah, I totally agree. And, you know, I think even a step further, routine and semi-urgent issues in healthy people that, you know, aren't urgent, if they don't become addressed over time, then also, you know, will further that as well. But yes, that's what I've been saying as well, that, you know, because we have such a huge chronically ill population, it's very worrisome. What advice have you been giving your patients or clients, or what have you, what's something that you didn't expect you'd be doing that's different?
Yeah, so for me, it's been trying to keep my routine as normal as possible. All right, try to remain some sense of normalcy, whether that's home workouts. I've been posting home workout videos, still posting nutrition videos. I've been telling people to try and focus on the positives, try and focus on things that they still have gratitude for, which is something I've instituted in my life recently. Before this started, was a gratitude practice every morning, right? We have the ability to choose one thought over another. And so you can choose to focus on the negativity and everything going on side, or you can choose to focus on things in your life that are still positive, things that are going well for you, things that you can work on, be productive in this time. This is a great time to invest in your health, to start a wellness plan. This is a perfect opportunity for that. So that's the major thing I've been telling people. And then I've just been pushing, you know, what our major agenda is. I'm like, look, all the things that you do on a daily basis before this either prepared you or left you completely exposed for this event. And so let's think about the next time this happens, because there is going to be a next time, right? There's going to be another outbreak like this. I'm like, okay, how do we put ourselves in the best position to handle that? So that's most of what I've been doing while this has been happening. And then I've been just trying to connect with people on LinkedIn, see what people are doing, see how I can help them, how they can help me, and how we can work together to help stem this tide of chronic disease.
Now, I've noticed that the term, it's started with social distancing. Now it's turned into physical distancing. And I think that's really important because people were feeling isolated and trying to come up with ways to, you know, connect with other people. What have you, I mean, I know you're doing a podcast and you talk to patients and clients. What have you been recommending in that area, how to kind of remain connected?
Sure. Yeah. And that's a very important point, is that isolation is a major risk factor for mortality for any disease, right? We know that the data shows that very clearly. And so, you know, words matter. And I think that calling it social distancing was a mistake in the first place. Physical distancing is what you actually want, right? And so I've been recommending use technology, use Zoom, use Google Duo, use Hangouts, use all these methods that we have available. Facebook groups, still be active in your Facebook groups, church groups, prayer groups, I don't care if you're in a cat group. Talk to your friends in the cat group about your cats. What's going on with your dog? We just fostered a dog. And so now we've been talking to people all over the country about dogs, right? Just because this is a new experience for us. And so there's so many different platforms out there where you can reach people who have like-minded interests as you do. So you don't have to feel isolated even when you're in your home. There are ways that you can connect with people all across the world almost instantaneously who have similar interests.
Now, I know in San Diego right now we can't use the beaches, we can't use trails. I'm not sure what the situation is in Texas, but we're still encouraging people to go out for a walk in your neighborhood, walk where you can walk, try to get outside every day. What's the situation in Texas right now?
Yeah, so right now we're still allowed outside. There are police patrols just to make sure people aren't congregating in places that people typically will gather. Now people are still walking on the parks and the trails and things like that. From what I've seen, they are still trying to maintain the appropriate distance from each other. So it is something I'm encouraging. Get outside, even if it's just stand in your backyard, even if it's just stand on your porch. Sunlight's very important for our immune systems, right? The data shows that very clearly, that we need to be outside in sunlight, in green space. It's part of our human condition. It's part of a very well thought out wellness plan. So I've been encouraging people just to get out into the sun any way that you can, in a way that's safe for you and what you have going on in your own life.
And I know nutrition's been important. I've heard from a lot of people, I'm going to gain weight, or I'm not eating well, I'm eating all processed foods. What are you kind of advising your patients and clients at this point?
Yeah, so it's the same thing earlier. I tried to tell people keep their routine as close as possible to what it was before, right? It's kind of a sad state when you go to the grocery store now. All the new fruits and vegetables and stuff like that are still fully stocked, and then all the junk food is gone, is completely gone. And so I've had no problem finding the stuff that I eat on a regular basis. And there's tons of it at the stores. And I just posted an article on LinkedIn today about this, about how nutrition, how fruits and vegetables and the compounds in these help our immune systems, have antiviral properties, have antimicrobial properties. So by eating fruits and vegetables and whole foods, you're actually helping your body's immune system, preparing itself for, if you do get sick, you're in a better position to handle that. So I'm trying to tell people, the same things as usual. Avoid the processed sugars, avoid the refined foods, avoid anything I usually tell people, if it doesn't walk, swim, run, or come from the ground, don't eat it. If it comes in a package, don't eat it. If you need a PhD to understand what's on the back of the label, don't eat it. That's usually like the simple kind of metrics I give people, the sandbox to play in.
I love that. It's so important right now. I mean, I always say, eat the rainbow as much as you can, right? So get out there, and you're right. You can go find broccoli right now. It's there.
Yeah, readily available. I've got a fridge stocked full of it. And, a lot of these vegetables too, you can freeze at your house as well. So if you're worried about them spoiling, a lot of people worry about that, but then they'll buy frozen vegetables. I'm like, you can freeze them yourself. It's the same process, right? So you can stock up on the veggies and freeze them and unthaw them for later use.
Yeah, absolutely. We've been saying the same thing. And it just blows me away that the entire vegetable section of the grocery store is just jam-packed. I've been making soups. Annie's going to laugh because I may have like 10 different soups like in my freezer, maybe like 100 servings at this point, because it's something I always do, but now it's out of control. What's your go-to food that you've been looking at in these last few weeks?
Oh, gotcha. Yeah, so I'm a huge fan of bone broth. So we'll make our own sometimes. Usually if we don't make our own, we go and get the Kettle and Fire bone broth. I love that brand. It tastes great. It's grass-fed, all natural product. And so we'll make soups with that, and then I'll just eat bone broth sometimes. If I'm feeling like I need a little bit more electrolytes, or sometimes if I just need that feeling of a nice soup, there's something really cathartic about a nice warm soup with the steam coming off of it, sitting on your couch and eating some soup. That makes us feel good. And so that's one of my go-to foods.
Annie's a big bone broth fan. Her face just completely lit up when you said bone broth.
Yeah.
I am. I'm a huge bone broth fan, and I go to the farmer's market to get mine, and I haven't been able to get it. So I'm going to have to venture into making my own, but I'm the same. And the nice thing about this is I'm sort of giving the same advice I was giving before. Now it's just people are listening, you want to eat better and, move more. So it's all the same. It's just now we're all taking that time. And I love what you said about the gratitude component of it. Now maybe people are home more and spending more time with their families and getting projects done that they have been putting off and slowing down life a bit. So in many ways, this is kind of what I've been hoping would happen for people. Maybe not this way, but they could take some time for themselves, focus on their nutrition, get outside more. So I'm happy you said that.
Dr. Harris, what about mindfulness or meditation? Where do you see that role in either your life or in the way you advise your patients or clients?
Yeah, absolutely. Meditation is a huge part of my wellness routine. People think I'm crazy, first of all. I'm going through pharmacy school, medical school, getting my MBA, and then having all these other assorted businesses and things that I do. Like, how are you not stressed? How do you find the time? How do you have the energy to do that? And I'm like, well, that's what my whole wellness routine is for. My routine is to make sure that my body can perform to the level that I need it to perform to. That's the whole part of a wellness routine. And a big part of that is meditation. So my schedule is I wake up, I say my prayers, and then I meditate for about 5 minutes. And meditation, most people think it's, you have to shut your brain off and just be still and be quiet. I can't do that. No, that's not what it is. It could be whether listening to some calming music, it can be listening to worship music. It could be you thinking about your goals in the future, reflecting on the life in the past. It's just getting in tune with your body and a way to listen to yourself. So there's no wrong way to meditate. Headspace and Calm are great apps to start for people who need a guided meditation. Otherwise, just sit down, listen to some calming music, and just see where your mind takes you. Just let it go freely. Feel like you're getting in tune with your body. Just that quiet and peaceful time is essential, especially in times like this where there is a lot of stress and uncertainty.
I'm happy your practice is similar to ours. Everything you're saying, be grateful, watch what you're eating, be mindful of what you're eating, trying to get people off medications and living a healthier life. I'm happy you're out there. I can't wait to meet you.
I had a couple of other questions. So, I think sometimes in the space you and I are in, kind of between Western medicine and Eastern medicine and trying to find the best practices of both, there is a lot of misinformation out there. And how do you help people? How do you guide people? And what advice do you give them so that they can, not make mistakes of going down a path where they could do something potentially that's harmful to them? I mean, I usually tell people, I try, when they give me some piece of something that they say they want to do, if it's not harmful to them, that's the first point for me. But I think now with everything that's going on with the COVID crisis, there's so much misinformation and people are so misled. How do you navigate that?
Yeah, absolutely. That's a great point because there's a lot of shadiness in the supplement market. It's a lot. It's so unregulated, and then people don't know what quality supplements are. So that's the first thing I tell them. I tell people, I don't care if you buy your supplements from me. I care that you're taking quality supplements. And so I teach them about GMP, about what that means, about how those supplements can be trusted, and then always make sure you get GMP supplements, about sourcing, about how to look into where the products are coming from, and how that matters. And then I'll tell them, I always tell people, before you put anything into your body, ask someone you know who's a professional if they can look into it for you. Someone you know, someone that can be trusted. And so I have people all the time send me screenshots of stuff and say, hey, is this something that's good? Can I take this? And then I'll just quickly go a little review and say, no, I wouldn't do that. Here's something better. Or say, yeah, that's okay. It shouldn't interfere with anything you're doing. But the most important thing I try to tell people about supplements is that it's only 5 to 10% of your goal, right? The nutrition, exercise, meditation, mindfulness, gratitude, all these other behaviors are really the pillars that hold up your wellness plan. And the supplements can help you reach the finish line if you are deficient in some areas. And there are certain supplements for certain conditions that are really beneficial, but I try not to get people to think that this is all that they need to do. Like they're just going to pop a pill, no matter what it is, and it's going to fix everything. Like, no, it's a part of the plan. It is not the complete plan.
Yeah, right on point. Do you think with this current crisis that we're in, that people are listening more to physicians and sound health advice, or do you think they've gone the other way?
Yeah, unfortunately, I see both. I see so much misinformation out there. And what I always tell people is before you post anything, just fact check it. It's not that hard to just do a Google search and
Right.
see if, okay, this seems like it's true or not, right? And so that's a big thing. It's the spreading of false information is harmful. It's extremely harmful. And so that's one thing I've been telling people during this time. But it does seem like from the engagement I'm getting on my social media platforms that more people are becoming aware of health and the determinants of health and how their behaviors and their mindset and their lifestyle impacts their health and wellness.
Yeah, I would agree. What are some easy tips that you could give our listeners for, what they can do today to change to improve their lifestyle in terms of
Sure.
behavior modification?
Yeah, absolutely. I love this question because this is where I start. My entrepreneurship professor told me, I was talking to him and I told him what I do. And he's like, oh, you're in healthcare? He's like, man, I feel so sorry for you. I'm like, why? He goes, well, the value in health is gone. And I went home and I sat there and thought about it. And I was like, he's totally right. People don't value being healthy anymore. It's almost gotten to the point where we just expect to get sick. Like that's just part of getting old now to most people is as you get older, you just get sick. That's just life. And I start with things that are high value that cost nothing. So when I'm trying to get someone to buy in, I usually will have them start with meditation or fasting because these are high value targets. There's a lot of benefit. There's a lot of research behind the value of these things. They literally cost you nothing and you can start these today. Right? You can start implementing these right now with almost no guidance and very little planning. And then you can start rolling down on the nutrition plan, on the exercise plan, on your mind, on your gratitude plan, right? And so that's a great way to get someone to start buying into wellness. If they start meditating, they'll feel better. Then like, okay, what else can I do to start feeling better? All right, I'm gonna start exercising. I feel better. What else can I do to start feeling? And you just create these habit stacks where you're stacking and stacking and stacking beneficial habits. And before you know it, your wellness plan is now just your everyday life.
Yeah, great advice. In terms of fasting, I mean, I know there's a lot of great evidence to support it, but there are some other forms of fasting that people have undertaken that are not safe. What do you tell patients to help them stay on if they want to do time restricted eating or intermittent fasting? Right. What do you recommend for them to keep it safe?
Yeah, so I walk through that with them. The time restricted eating is usually where I have people start, right? And so the 16-8 method's the one a lot of people use. It's very easy. That's where you eat. Most people will eat their calories between noon and 8 p.m. and then fast the rest of the time. So I usually start them with time restricted eating. I'll usually tell them just slowly increase the window, like do 2 hours one day, then 4 hours, then 6, then 8, then 12, right? So you gradually shift into it. So a lot of times people fail because they make dramatic big changes and then they feel terrible and then they don't go back to it, right? Well, I usually tell people you wouldn't just sign up for a marathon that's tomorrow and go run it. You'd feel horrible. So this is the same type of principle. You have to train and let your body adapt and adjust to these new changes. And then as when we start talking about fasting, I usually tell people there's a couple different ways that you can fast. There's some fasting kits like Prolon out there that are great for getting your body into a state that's used to fasting. But fasting is a double-edged sword. So too much fasting can be too bad. It can be bad for you. People who have high levels of stress, HPA axis dysfunction, their stress axis is all abnormal, can respond very poorly to fasting. Women actually, respond poor to longer fasting periods than men do. It's a hormonal disruption issue. So there are some individualization you have to do with people in fasting. So I tell them that it is beneficial, but it's like a lot of the other beneficial things. Too much of it is bad. So you have to find your sweet spot, find what works for your body, listen to your body, and then go from there.
Yeah, great advice. So wrapping up, what would you like to add that we haven't asked you?
In general, I just want people to know that they can have everything out of life that they want to have. They can reach for the stars. They can achieve greatness. They can satisfy their dreams. They can provide for their families. It's all out there, but it's really on each and every one of us to go out there and take the steps to make sure that happens. No one's going to hand it to us. And it's the same thing with your health. You can take the power back into your health. And this sounds weird coming from a healthcare professional, right? But I want people to be empowered to make accurate health decisions, to make decisions about their own health, to be in a place of power when they come and talk to us, because that makes it a better conversation. And then we can really work to help each other, right? To get you on the way to that wellness goal. So that's pretty much all I think that I have to say that we haven't covered, but it's been a great conversation. And
that's as good. Usual, I forgot to ask you about the keto donuts. So tell us
about
that. Yeah. So, right after we wrap up about fasting, although I think in the COVID crisis, the fasting window, the most we could probably get it is like 20 minutes or something like that. So yeah.
Yeah, so me and my girlfriend run a keto Facebook group called Keto Connected, and we make low carb recipes, and some of your favorites, right? And so she makes these blueberry and strawberry keto donuts that are unbelievably good, and they have the consistency and everything. Tastes like donuts, and so we do that so people know that there is a way, if you're going low carb, to have your favorite foods, your favorite recipes that you can make at home in a way that's much better for your health.
Okay, we're going to need that recipe so that we can post it for sure.
Absolutely. I'll get that to you.
Okay. Thank you so much, Dr. Harris. It was a pleasure talking to you today. Thank you for your time. Be safe and well. And thanks again. And we'll link all this stuff on the podcast and YouTube. So have a wonderful day.
Absolutely.
Thank you.
Thank you.